Did you know you could be walking around with advanced liver scarring and feel perfectly fine? Studies now show that millions of adults over 50 already have dangerous fibrosis, even though routine blood tests still stamp their results as normal.
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're exposing the silent epidemic that could be threatening your liver right now.
I'm Alara Skye, and the reason you rarely hear about liver fibrosis is that it develops quietly. Your liver can lose a remarkable share of its capacity before you feel any discomfort at all. Standard enzyme checks such as ALT or AST usually look acceptable until late stages because the cutoff values most labs use were set decades ago and never modernized. That means you might leave the clinic believing everything is fine while scar tissue is steadily advancing.
The conversation has long centered on fat in the liver, but research makes it clear that fibrosis decides who moves towards cirrhosis or cancer. Fat can melt away once you change habits. Scar tissue stays and keeps growing when insulin resistance, toxic vegetable oils, or alcohol injure liver cells faster than they can repair. The real threat is the stiffness that gradually chokes blood flow and stalls detoxification.
Older adults, people living with type 2 diabetes, and anyone carrying extra visceral weight are at highest risk. A recent paper in the Lancet Regional Health Europe warned that most cases of what they call at-risk steatohepatitis march forward silently until moderate or advanced fibrosis has already formed. By that point, full recovery is dramatically harder and, in many cases, impossible.
Why do we miss it? Because the reference ranges for AST and ALT still considered normal were drawn from unhealthy populations back in the 1970s. Molecular biologist Dr. Brian Walsh points out that healthy adults should sit below about 20 units per liter, not the mid-30s you see on many lab summaries. Using those tighter limits would flag liver stress years earlier and open a window for reversal.
Primary care offices already manage blood pressure, cholesterol, and A1C, yet they seldom add a simple fibrosis, 4-index, or elastography scan when the same patients show clear metabolic red flags. Researchers are urging electronic health record prompts so the check becomes routine, but until that happens, you have to request it yourself. Ask for non-invasive imaging. Your odds of catching fibrosis early jump dramatically.
If you have diabetes, the stakes double. The American Diabetes Association notes that roughly 70% of people with type 2 diabetes accumulate fat in the liver, and nearly 1 in 5 already harbor hidden scarring. That 1-2 punch accelerates heart disease, kidney decline, and early mortality far beyond blood sugar issues alone, making proactive screening non-negotiable.
The ADA now recommends 2 quick steps. First, calculate your FIB4 score from age, enzymes, and platelet count. If that number is elevated, follow up with a liver stiffness scan. Both tests are non-invasive, widely available, and pinpoint fibrosis before symptoms appear, precisely when lifestyle changes can still reverse the damage.
Language matters too. Researchers writing in Nature Medicine found that labels such as alcoholic cirrhosis keep many people away from care because they feel judged. Reframing the condition as steatotic liver disease or managing fibrosis removes blame and speeds up screening, treatment, and even transplant approvals. Clear, supportive language turns out to be a powerful medical tool.
Beyond better words, new diagnostics are arriving. Ultrasound elastography quantifies stiffness, microRNA signatures flag early cellular distress, and genetic risk scores identify families who need tighter monitoring. These tools remain underused outside specialty centers, but asking for them pushes the system to act sooner instead of waiting for irreversible scarring.
Screening is vital, yet decisive action matters just as much. The first move is dumping vegetable oils, soy, corn, canola, anything sold as vegetable. Their high linoleic acid load converts into oxidized metabolites that attack your mitochondria, the same way acetaldehyde from alcohol does. Eliminating both removes a constant chemical assault on your liver cells.
Next comes choline, the nutrient that keeps fat moving out of the liver instead of parking inside it. Pastured egg yolks deliver a concentrated low PUFA source, and grass-fed beef liver works too. Without enough choline, fat stalls, inflammation rises, and scar tissue follows.
If eggs or liver rarely land on your plate, consider a therapeutic citicoline supplement between 500 and 2,500 milligrams daily. At those doses, you restore choline supply, support acetylcholine for clear thinking, and give your liver the raw material it needs to export fat before it hardens into fibrosis.
Daily movement is the final pillar. A brisk walk after each meal drops insulin, pumps fresh blood through hepatic tissue, and shrinks visceral fat. Keep your waist below 40 inches if you're a man, or 35 if you're a woman. That single, simple metric tracks closely with liver strain and future risk.
Remember, fat itself is not the villain. Fibrosis is. Catching minimal scar tissue early means you can often reverse it within months by removing harmful oils and alcohol, hitting your choline targets, and staying active. Your liver has a remarkable capacity to regenerate when the assault stops.
The obstacle is silence. Your liver can lose function for years without sending obvious pain signals. Waiting for swelling, jaundice, or confusion hands fibrosis a massive head start. That's why the smartest move is to test before you feel a single symptom.
So, take inventory today. Look at your lab report. Are ALT or AST above 20? Do you rely on processed foods fried in seed oils? Is your waistband creeping higher? Each yes is a prompt to ask for a FIB4 calculation, and if needed, an elastography scan.
Your challenge is straightforward. Over the next 30 days, replace every bottle of vegetable oil in your kitchen, add 2 pastured egg yolks to your daily meals, and walk 10 minutes after each time you eat. Retest your enzymes and celebrate the progress.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.